A historic medical milestone was made here after the first patient underwent a robotic radiotherapy treatment known as Cyberknife. My name is Gloria Milimu, and on this episode of Health Digest, we explore this new technology and how its game-changing approach to cancer management could change patient outcomes. Oncology is witnessing remarkable breakthroughs driven by cutting-edge technologies and innovative approaches. As scientists and researchers make these revolutionary advancements that continue to shape the landscape of cancer care.
Good morning.
Here in Africa, a revolution in cancer management is taking place, giving hope to both patients and medical professionals alike. Kenya made a significant leap in tech and cancer treatment when it officially launched Cyberknife, a robotic radiotherapy system at the Kenyatta University Teaching, Referral and Research Hospital. So, how is this launch set to shape the future of oncology in Kenya? Before we get to understand that, let's first explore how the technology works. Experts say Cyberknife is set to revolutionize cancer care, not only here in Kenya, but also in the region. Currently, there's a patient undergoing this procedure. Come with me to the control room where doctors are currently administering this type of treatment virtually.
Gloria, this is our control room. So when we come in, the first thing we usually check is the patient is okay. So this CCTV cameras, they can show us the patient, and as you can see, they're from different angles. The other thing we do is confirm that the patient is okay. We've got our intercom here. You can try if you want. Hi. Yeah, so the patient will be able to hear you from the room, and in case of anything, you can also hear them and they can tell you like we need to come out or something like that. When we're happy there, this is where we start, yeah? Although the machine is robotic, you know, with robot, how it works is like you have to give instruction for it to work. So all the instructions come from here. So we come here, we go to the treatment, we identify the patient. It's a healthcare professional. Identification of a patient is very important. We can even do it like 10 times, especially when it comes to radiation. You know, we give a mega voltage of radiation. And the only problem with the radiation is that once you give it, that's it. It can't be taken out. It's given. So that's a key issue. We identify the patient, we identify the area that we are treating, even though we would have already done it. These are just like a double checking measurements we have to do. So identify the dose, confirm the fraction, because we've got different fractions, and then we go. When I talk about fraction, what I mean is that for every patient, depending on the area we're treating and the location of the tissue, the tumor, we do the dose in different fractions. So every single day you receive the same dose, but for certain days. Like the first patient today, or for the first patient for this session, he's receiving 5 fractions. So the dose is divided into 5 fractions. So every single day we have to confirm, like today is the 3rd fraction. So we have to confirm here, confirm the prescription that he's receiving and how much is left. When we are happy, we carry on. So we usually have 2 people. Legally, it should always be 2 people. So the person sitting here, you're checking on the numbers because you have to tell the machine, go this way or this, although it's already planned. But the main issue when you're sitting here is sometimes the patient might cough. This machine is very sensitive. Even a cough, it will stop. Or maybe the figures will go up and the machine will cut off. So you adjust, or sometimes you might be sitting here. Let's say for an instant we are treating an elderly person, maybe you need a break. So you look at all the times, this is you have to keep looking at them and talking to them, because most of the patients, they need reassurance, a lot of reassurance. So talk to them, make sure they're okay. If anything, machine cut off, do your numbers, carry on again. Those who need a break, stop. We've got emergency button here. Stop. Give a patient a break if they need a break. Some people they want to go for like just a break or a cup of water, and then that's it. In case of anything, big emergencies, like something is happening, it's a robot, anything can happen. We've got this emergency button here, so we stop. If we stop this one, that's a very big emergency, and that will stop the machine completely, and everything has to be redone again.
Chemotherapies, surgeries, and radiotherapies have characterized the battle against cancer for decades. However, significant advances in cancer care, like the use of Cyberknife to treat tumors, continue to pave way for better treatment outcomes for patients.
We are doing a lot of research in terms of cancer management. We are actually moving from chemotherapy to what we call precision medicine. Everyone has a different tumor marker, tumor driver, and we are trying to see what those tumor drivers are to give these patients the appropriate treatment. So with cancer, I think it's very diverse. It depends on the kind of cancer, your age, and all these things to see which treatment best suits you. But we cannot say it's only chemo, and those are probably you need those, but even radiotherapy is also coming into play in a big.
In Kenya and sub-Saharan Africa at large, the journey has just begun. Following the launch of the Cyberknife system that now makes Kenya the second country in Africa after Egypt to install the stereotactic radiotherapy system.
Gloria, from the control room, we come to the treatment room. And with the treatment room, I'm sure you can see the corners here. You see it's a very big, like a long corridor here. So what we do, we deal with mega voltage of radiation. And one thing with radiation, it doesn't travel through corners. So that's why we've got a long corridor, and we've got these corners here. So you can see the machine. It's massive, it's intimidating, but that's how it's meant to be. Yeah? We use a carbon fiber bed. That's with radiation. If I can say just like in very simple terms, the dose prescribed, you want it to be not to be shared with anything. Because sometimes this machine is a robot, it can go under the couch, so we need to use the carbon fiber one, and it's shaped in a way that will be able to treat all the patients here. So you can see this one, like here, it's for patients we are treating for head and neck. So what we usually do, we use a shell and just make sure that they're there, because we want to ensure that the patient can't move. The more they move, we'll change our numbers outside, as I was trying to explain earlier on. So we clamp them with shells, and then they have to be very still. This is the shell that we use for head and neck patients. And when I mean head and neck, it's only anything for the brain. If it's anything on the neck, it'll be different shell. Or if we are treating the higher part of the lungs, it will be a bigger shell. So the shell will come up to here. So with this is our dummy here. So we'll clip the shell like that to the patient, and this will make sure it's just an immobilizing device. So make sure the patient doesn't tilt their head. They're there. If the shell is too tight, because what happens is that they get molded, and when it's molded, it's warm, nice and warm. So when it cools down, it gets a bit tighter. So sometimes the patient, it might be too tight, we can adjust. We've got something to put here and we can adjust. Because at the end of the day, you want the patient to be able to tolerate the treatment. If it's too tight, they won't be able to. So these are the lasers. They're the ones we use to set the patient up. We can switch them on or off from here. It's a bit colorful. Ceiling, the wall. Maybe tell us what's the reason behind that? The reason behind this is we all have been to hospitals, and sometimes just walking into hospital, you've got that feeling. Even for me, despite that I do this when I'm a patient somewhere or when I'm going to visit someone, the minute I walk into hospital, I panic. So to make the patient like calm down, feel relaxed, feel somewhere nice. We've got the pictures here. Like we've got that, which is a very good, like it shows Kenya. That's how Kenya is. So as you walk in the room as a patient, it seems like you're walking to a nice place. That one there, this one there. That when you're lying down here, you can just imagine that you're somewhere hot, somewhere like Spain. Yeah, yeah. That's just to calm the patient down and to change their perspective that I'm in a hospital. Yeah. Instead of that, like when the patient is here and they've been treated, it's painless. They don't feel any pain at all. What they will see is the machine coming very close to them, of which that's something they will already be aware of because we would have told them beforehand. For an example, now we're treating a brain patient, a very young guy, and he's coping very well. The side effects, usually what they had presented with before they got diagnosed, are still the side effects. The only other extra side effect they get from the machine is because, you know, as I said, we're dealing with high voltage of radiation. It makes someone tired. So they might feel very tired, and sometimes also it's not only the radiation making them tired or the treatment making them tired, they also have a journey to come. So coming, because it's outpatient treatment, so they don't stay in. They're able to carry on with their daily routines. Some of them they work, they're carrying on with working. Some of them they've got family, they still have to carry on. So that will also make them feel tired. So the journey, the treatment, and also what they're doing during the day. But what we usually advise the patient is that in case of tiredness, just take a break. If your body tells you I need a break, take a break. Try to drink a lot of water, because as you know, the more dehydrated you are, the more tired you get. So they drink plenty of fluid, and yeah, they're usually okay. The other side effects related to the treatment, but it depends which part of the body we are treating.
Radiation therapy is one of the main methods of cancer treatment. However, the side effects associated with the procedure has always been a major cause of concern for many patients. Even so, high-tech radiotherapy technologies like Cyberknife are slowly transforming the treatment journey of thousands of patients diagnosed with cancerous, non-cancerous, or even other conditions that can be treated using this type of radiotherapy. The treatment is said to be painless and non-invasive and delivers precise pulses of high-dose radiation that targets the tumors and abnormal tissues.
Cyberknife is radiotherapy still, but very precise, very accurate. It's able to avoid or evade critical structures, the brainstem, the cochlea, the eye. So this is why Cyberknife has become now the new technology, a bit higher than EBRT. But also this kind of technology, we call it stereotactic radiotherapy, can be done by a normal machine, a Linac machine. Why the Cyber is a bit different is because of the robotic arm. So the arm is able to do up to 6D kind of treatment with sub-millimeter accuracy.
Cyberknife system, according to experts, uses advanced technologies to track tumors anywhere in the body. Its unique robotic design, they say, keeps the radiation on target even while the tumor moves.
Cyberknife, the 6D, the robotic arm, moves with even the patient respiration. That is where we are able to treat tumors that are in areas that respiration is normal, like in lung cancer, pancreatic cancer. Also in the pelvic region, there's a lot of movement because of the bowel and all this. So because of that, 6D is able to follow every movement that is being done, up to sub-millimeter accuracy. In the brain, the structures are a bit more stagnant, they don't move as much, but the robotic arm is able to shoot beamlets from all the 6 dimensions. The robotic arm moves around the patient, just trying to give the patient as much dose in the correct areas, avoiding the structures that are critical, just to give the dose to the tumor. For children, it's quite tricky. Our treatment, the patient must sit still for 30 minutes, 20 minutes portion. So for children, of course, it's tricky. We most likely have to give them some sort of sedative. So we are not yet treating children just because of that, so that we can be able to bring in the anesthesia team on board and see what kind of sedative we can give the child so that they can sit still for 30 minutes. It's not easy. Even our grown-up patients, sometimes we give them breaks.
According to radiation oncologists, when treating cancer with conventional radiotherapy, the radiation dose delivered to the patient is relatively small over several weeks. The goal is often to maximize tumor cell death and minimize damage to healthy cells.
How the Cyberknife is very different from conventional radiotherapy is the number of sessions. For a particular patient, we're doing just 5 sessions of radiation. Normally we go up to 25 to 30 sessions of radiotherapy. So by a session, I mean the time the patient needs to come to the machine. Normally do Monday to Friday on conventional. The Cyber just does, just the 5 sessions can be done within a week, and the patient is able to continue their normal process.
Even though Cyberknife, just like Gamma Knife, a clinically proven system for delivering high-dose radiation to tumors with sub-millimeter precision are similar, Cyberknife is able to perform treatments throughout the body and also tracks the tumor while giving real-time imaging during treatment.
So the Gamma Knife, unfortunately, can only do head tumors, brain tumors, so to speak, but the Cyberknife can be able to do for the rest of the body. Technology is pretty much the same. In terms of the technology is the same, so it can still do SBRT. This is stereotactic radiotherapy. The Gamma Knife does the same. It's just that the Gamma is just mainly for the head and neck region, and the Cyber can do for the rest of the body.
So we're just gonna carry on with the treatment. You're doing very well.
Experts say the introduction of Cyberknife reinforces Kenya's commitment to advanced healthcare. Its launch, that cost at least 700 million shillings, not only bridges the accessibility gap, but also affordability.
In terms of cost, the cost of treatment is between 300,000 and 350, and that variance is because of the number of sessions. Because higher the number of sessions, the more expensive. But the sessions will vary from 3 sessions to 6 sessions. So between 300,000 and 350. And happy to note that this cost will be made by NHIF for those with a card, NHIF card. For those without the card, we are hoping that the insurance covers. And also, it's a new machine, so I'm sure they have to do some work to include this particular service in their cover, since it was not there before. And then, of course, there are those who also pay cash.
Advances in cancer care in the country has been significant. The introduction of PET scan, a nuclear medicine imaging test that combines positron emission tomography with X-ray computed tomography imaging in a single test to evaluate how the body works, was a sigh of relief for patients who ordinarily would travel abroad for the services.
We've been looking at reasons why Kenyans go out for medical services. But one of the reasons we found out earlier on is the PET scan machine. As you know, we launched that one for the diagnosis of cancer. Then we kept looking at the list, and the next reason why people go to other countries is the Cyberknife for the treatment of the tumors. So in terms of tourism, clearly many Kenyans now don't have to go, and we have seen it with PET scan. We have now, if you can allow me to just go back a bit on PET scan, we have scanned 6,000 Kenyans. So you can imagine all these people would be going out of the country for this. And you can imagine how much money Kenyans have saved. So we think the same and even more will happen in terms of this Cyberknife machine.
Now that Cyberknife, this is the first machine that we have in sub-Saharan Africa, this is a game changer, definitely. Radiotherapy, cancer statistics are going up. I think this is something that we all know. So the more treatment options that patients have, the more we can treat them. We are accepting any patients from anywhere in sub-Saharan Africa or beyond. We have a hospitality center that is ready to receive these patients. We have a center that the patients can sleep over, just doing their treatment. We have a help desk where you can call in and ask whether you're a candidate, and a doctor can see you for free. For now, we are doing just consultation to see whether you're a candidate for this kind of treatment. So we have set up, the Cyberknife is open to any consultants, any doctors who need to see whether their patients qualify, could contact any doctor who's working in KTN directly or otherwise, and we'll see whether their patients qualify. We see them in the clinic and see whether they're a candidate for this.
The government's move to make Kenya a medical hub is seemingly gaining pace, with the launch of such services that adds to a growing list of medical services now being offered locally that would see thousands travel abroad in search of. Continuous training of personnel for these services is said to be key in promoting the universal health coverage agenda.
So it is one thing to have the machine in the country, and it's another one to have the training to use the machine. So we have been training our staff. We have trained our radiation oncologists. We have also trained our medical oncologists. We have trained our radiotherapists and also trained our medical physicists. All these people have been to US for training, and also there was training here when the machine was set up, so by people from actually the manufacturers. So we have a good team already trained. We're also lucky to have one of our own, a girl called who has been working. She has been a Cyberknife manager in the UK, and she could not come back to Kenya because there was no Cyberknife in Kenya. So the minute she realized we have Cyberknife, she applied for the job, and we gave her the job because she's a very experienced radiotherapist. So we have a good team, and we'll continue training.
There is no doubt that the world is in a transformative era of cancer research, as innovations in the oncology space continue to pave way for quality care. Experts say the launch of services like Cyberknife continue to shape the future of oncology. Gloria Milimu, KTN News.